Hello and welcome to this Every Birth Matters video on misconceptions and common questions that a lot of women have during their pregnancy, but also a lot of questions that women don't also know that they can ask. So I've collated 5 questions that seem to be the most common questions that I'm asked during when I'm supporting a woman as a doula or during the hypnobirthing course. So I've written those 5 questions down, so I'm just going to briefly talk through them now just to give you a bit of an insight into what those questions are and what you can do about them. So the first one is labour painful? So a lot of the videos and stuff that we see, a lot of the images that we see depict that labour is painful, and a lot, depending on what it is you watch, also depends on how we perceive women in labour. And we mustn't forget from a hypnobirthing perspective that the subconscious mind will store that information. So when it comes to your own birthing, you understand from what you see around you and from what women share is that labour is painful and stressful. So for some women, especially ones that hypnobirth, labour isn't painful. So it's just to put that into perspective that labour can be painful, and as a general rule is painful. But when you're hypnobirthing, a lot of women say that they find their inner strength and they're able to concentrate on sensations more than pain because they don't feel tension and they don't feel scared. So if you want to know more about that, then do watch some hypnobirthing videos on YouTube, because that will help you understand that pain is different for every woman. So I hope that helps. Next question. So will my care providers tell me what to do? So I always say to women, what do you expect when you're in labour? And a lot of the common questions are, a lot of the common responses are, I expect my care providers to tell me what to do and guide me. And that is a really tricky area, because what that kind of means is that you're handing over to care providers to make the decisions and advise you on the things that are best suited to you. But it doesn't necessarily mean that they're best suited to you. Only you know you better than anyone. So your care providers can offer you advice and support and guidance, but they can't make decisions for you. However, sometimes it seems like they are making decisions for us. So if you want them to tell you what to do, they will do that. But at the same time, if you want to take that control back and empower yourself and be the powerful one in the room, then you can do that, because you're ultimately in control. And no one can really tell you what to do. It has to come from policy or guidance that the hospital use. But if ever you're unsure, you can always look at the NICE guidelines to give you that information. Number 3, will I do a poo in labour? Now this is something that some women ask, or sometimes not, because they're not sure on what the answer will be, and it's different for everyone. Some women, let's be realistic about this, the pressure of a baby coming down through the birth path can put pressure on the back passage. So some women will poo in labour. Now that means whether you're on the bed or whether you're in the pool. So it's just to get that in perspective. Some women don't do a poo in labour. Some women might go to the toilet before labour starts and have a bit of a clear out. So it all depends on the type of person that you are, and at that the type of, well, the birth that's about to happen, really. If you feel, I tend to find that if women are a bit nervous before as labour starts, then that can sort of help you have a clear out, or depending on what certain foods you've eaten. But then usually as well, at the same, you could also poo in labour as well. Midwives are very aware of it, so it's unlikely that your partner is going to observe you pooing all over the place. It's not like that. It's more when it happens, midwives are very aware of it. They know baby's on the way down, so they can just move it out of the way and get rid of it. All right, nothing to worry about. 4th question, what does VE mean? So VE means vaginal examination. So during labour, your care providers are more than likely going to want to do a vaginal examination to see what's happening down in your cervix. So the examination will only tell them what is happening at that point. It can change within 10 minutes. So you might be 4 centimetres 1 minute, then 10 minutes later you could be 8 centimetres. Every woman is different. So vaginal examination is usually what they would expect to do, roughly every 4 hours. However, you can say that you don't want that. So if you don't want a vaginal examination, you don't have to have one. And if a midwife does want to do an examination, or a doctor wants to do an examination, they have to get consent from you to do that. So you don't have to. Ultimately, you might feel, actually, I feel a bit different down there, I'd like an examination, and that's your choice to request that. And the last question, what does positive birth really mean? Positive birth is about women feeling powerful, feeling in control, and feeling that they have a voice in their labour. A lot of women don't feel that they have that. Hypnobirthing tends to give women the strength to be able to ask care providers questions, feel powerful within their body, and feel confident with what they're doing because they know what is happening within their body. Positive birth isn't just about having a healthy baby and a healthy mum at the end of it, as much as everybody wants that, and that's absolutely paramount because that's what everybody wants. But what happens between the start of your pregnancy up until you have your healthy baby in your arms, or you're feeling healthy yourself, it matters. Everything that happens from that first twinge that you get to when your baby arrives, it matters. It has to be, women have to have a voice, women have to be able to talk. Partners should also not be dismissed, they should also be encouraged to have a say and support their partners the way they feel that they need supporting. So it's not just about having that healthy outcome, it's about everything else that happens in between. So if your partner is ignored, or you're told what to do, or you're forced to do something, or you feel coerced, and these are words that I've heard from women, then these are really important things to consider, because after birth, you're the one who has to live with that birth story. You will share your birth story, no doubt, with other women, because that's one thing that they like to do. But you sharing that birth story, it will impact on the rest of your life. It's the one story that you will never forget. So actually making it positive, having that calm approach, and feeling comfortable with what you're doing is really, really important. So that's it for those questions. If you've got any other questions that you want to ask, you can always email me, or if you want to, you can attend the information session to give you more information, or you can sign up and buy my Positive Birth Starter Pack, which has everything in there to get you started on the way to a really good positive birth. I hope you've enjoyed the video, and I look forward to seeing you or speaking with you soon. Thank you very much for watching. Take care.